My name is Amanda Banach, and I'll be talking to you about my thesis. So I called it Have You Gone Noseblind? Anosmia as an Indicator of COVID-19. So I specifically looked into the effect of medications on one's sense of smell. So some medications have been documented to have an impact on one's sense of smell. Koldhofer, Orenberger, and Schaap in 2016 showed that birth control medication may have an impact on sense of smell, specifically that lower doses of ethinyl estradiol may increase olfactory performance in identification, and it also may lower odor detection threshold levels. So other medications may limit and actually decrease one's olfactory function. So these types of medications include antihistamines, antibiotics, blood pressure medication, and antidepressants. So these may decrease olfactory function due to the way that they disrupt normal function via nasal secretion differences, blood flow to the nose, or by disrupting the electrical impulses of smell receptors. So the way that we looked into olfaction is we had participants test their sense of smell weekly using the 8-item Sensonic smell test. So they were asked to identify each odor using a 4-option multiple choice. They were also asked to rate each odor for the intensity and the pleasantness on a scale of 1 to 9. So there were 93 participants in our study that did not take any medications. There were 18 participants that were on those negative effect medications that I just mentioned. And then there were also 18 participants that were on birth control. So first I looked into the odor identification differences. So the average score for our no medication group was 6.495, and there was a standard deviation of 0.746. And then we also looked at that same stuff for our diminishing olfactory function group. They had a mean score of 7.5 and a standard deviation of 0.786. So I ran a t-test between our no medication group and our negative effect medication group. They had 109 degrees of freedom. The t-value was 1.982, and there was a significant effect with a p of less than 0.001. So our birth control group had a mean score of 6.722. They had a significant difference of, standard deviation of 0.461, because it was the same sample size. They also had 109 degrees of freedom with a t-value of 1.82, but this one was not significant. The p-value was 0.215. Then I also looked at the intensity differences between all three groups. So this shows the average ratings by odor. So I ran a 3x8 ANOVA with this data. I did find a main effect of odor, so p was less than 0.001, but there were no effects for the medication or interaction effect. So those p-values were 0.064 and 0.445 respectively. I also ran a one-way ANOVA just with all the data, and I did still find a statistically significant effect of odor. So some things that we should talk about is what those results even mean. So it is somewhat consistent with past research. It shows that those negative effect medications did have a negative effect on intensity. It was odd, though, that in our sample, they did have the highest average number of odors identified correctly. So that was just not consistent with past research. Some things that we could look into further with our birth control group would be to ask participants what the strength of their birth control was and how long they've been on birth control at all, because those have been shown to have some differences in one's sense of smell. And then for our negative effect group, this actually did show similar trends for the odor identification and odor intensity ratings to our COVID data. So it had a higher odor identification average than expected, but it did still show some decrease in olfactory function with that lower intensity ratings. So something else we could look into is the number of medications in a college-age sample. Schiffman did find that there was a significant decrease in olfactory function among elderly patients that were on more medications than their counterparts. So if we also looked at that in a college-age sample, when your olfaction has not decreased due to age, it would be interesting to see if there was still that same effect. So here are a couple of the references that I used specifically for my analysis, and that's all I have for you guys. I look forward to your questions, and yay, we're done with thesis.